Hello. It's Thursday, August the 17th, and this is an introduction video to the Soci 3313, Sociology of Health. I'm Steve Blanchard, the instructor. I want to just talk briefly about the syllabus. I put it in front of you, tell you a little bit about what the course is, put the syllabus in front of you. It's up posted. When you see this video, you'll have access to the syllabus because Blackboard will be open. And then I'll be back with a video on Wednesday morning to speak more specifically with something that you've had a chance to take a look at, which will be the syllabus and the first assignment, which is posted and described in the syllabus, so that I'm not speaking to you here something that you're not, when you're reading this, you haven't had a chance really to take a look at any of the materials up on Blackboard. So when you see this video, the syllabus is posted because Blackboard's available to you at this point. We're doing a YouTube video today because VoiceThread on my Blackboard wasn't working. So hopefully when I do the video on Wednesday, I'll have VoiceThread available and I can use that. I prefer it because it's easier logistically to do than YouTube. I've done a lot of YouTube videos, but when I do this and I have to save it, YouTube processes it and then sends it to me, then I got to send you the link, and it's convoluted. Whereas with VoiceThread, I could do the video. It looks just like this, and as soon as I save it, it's available to you, much smoother and easier, and all of that. So let's hope that they can get my VoiceThread fixed the next day or two. Okay, so some things to do. Let's talk a little bit about sociology of health and why we call it that. Sociology of health is, first off, the sociological perspective is the contextual influences on human behavior. What are the social, contextual, environmental influences on human behavior? And in this course, what we're focusing on are those social, contextual, environmental built influences on health-related behaviors. Now, when we think about health-related behaviors, we're not clinicians. We're not thinking about your particular health or my particular health or anyone's particular health. We are population health diagnosticians in this course. We are looking at population health in neighborhoods, or by gender categories, or by age categories, or race and ethnicity, or however we might want to define populations. We are population health diagnosticians. We're not clinicians. And so that we're looking at those kinds of behaviors, health-related behaviors, that give rise to variation in population health, say across an urban environment from one neighborhood to another. And what is there about those contexts in those neighborhoods, let's say, that affect that variation in population health from one neighborhood to another? We'll have lots of conversation about this as we move forward. There are a couple of ways that we think about it. One is kind of an older one, 20 years, 30 years old maybe, called the social determinants of health. You'll see references to that, some links on the first page of the syllabus. Take a look at the World Health Organization document, Social Determinants of Health. The authors of that PDF are also the authors of the text. You'll find up there in that first introduction folder I have up there a couple of YouTube videos of a presentation address that Michael Marmot gave to the American Association of Public Health a couple of years ago. I had the privilege of being there and listening to the gentleman live speak. If you listen to those videos, you'll get a really good sense quick about what we're up to in this class. There's another one up there in that same folder by Hans Rosling. Take a look at that. That one's fun. Marmot is too, but he's pretty technical. Rosling is looking at how does income affect life expectancy in terms of changing context of income changing context of life or outcomes of life expectancy. Life expectancy is, and we'll talk about this later in the semester, well, not so later, but next week or so. The life expectancy is the average age of life for any population. Like, for example, non-Hispanic white males like me, maybe their life expectancy is 80 years. And so that if somebody were to die earlier than 80, they would die prematurely because the expectation of life is 80 years. So when we think about that, one way to kind of take a look at the upstream, downstream, or social determinants, in other words, what's the social determinants of life expectancy? Why does it vary from neighborhood to neighborhood? And to point that out, you can look at up there the PowerPoint presentation for the 2016 Community Health Needs Assessment. I put on that PowerPoint a series of maps of life expectancy. In that that CHNA, we'll call it, Community Health Needs Assessment. In that CHNA, we were using, and it is common in community health around the country to use zip codes as proxies for neighborhoods. We were characterizing zip codes or neighborhoods in Bexar County by a life expectancy, and you'll be surprised, I'm sure perhaps shocked, that the variation in life expectancy inner city relative to the north side of Bexar County is as much as 15 to 20 years. That is a generation. In other words, people in some of the zip codes or neighborhoods in the inner city of San Antonio are dying 15 to 20 years prematurely relative to people on the north side. What is the social determinant of that? What is going on in those neighborhoods? What are the health-related behaviors that give rise to those disparities in life expectancy? What are the features of the neighborhoods that give rise, social contextual built environmental features of the neighborhoods in those zip codes that give rise to that disparity? These are the questions that we ask. And when you, on down in that first page, you'll see a link to Upstream docs, and there's a characterization of social determinants as downstream and upstream, so that we look downstream at life expectancy, midstream to behaviors, and far upstream to social context, so that social context give rise to behaviors, give rise to the life expectancy. This is the way that we'll work our way through population health throughout the semester as sociologists, social scientists, and that sort of thing. Now, there are, of course, some requirements for the course. You'll be doing 4 written assignments, there's 4 segments in the course: a demographic segment, a social cohesion segment, a social network segment, and an income inequality segment. Income inequality, social cohesion, social network will be 3 ways that will characterize upstream and imagine what are those influences, either from standpoint of income inequality or social networks or social cohesion, that influence behaviors that give rise to the downstream population health outcomes. Segment 1 is demographic outcomes, and I'll do a video on that this next week. And that's just to get us comfortable with measuring population health in terms of features of birth certificates like low birth weight, and features of death certificates and mortality. We'll talk more about that next week. But you'll do a paper select an article. There's a folder in each of those segments on Blackboard with a number of articles, and you'll pick an article and summarize that article in terms of that particular segment and what it tells you about downstream outcomes. And it'll also be an article that you will represent in discussion. We have a lot of discussion. I don't think I've posted the discussion thread yet. I'll post it Monday or Tuesday, a discussion thread where we share our readings and our developing perspectives on contextual and behavioral relationships to population health outcomes. And then the final requirement is a comprehensive essay. And often what students do, I've done this course a number of times, often what students will do is when they're working on one or more of these 4 4 assignments, they get into something they really like. And so they'll pick that and expand on it a little bit for the comprehensive essay. And we'll work our way through this. You'll see how that works as we move through the semester. Okay, I think that's, there are no exams. There are the 4 papers. The grades are the discussion, the 4 written assignments, and the comprehensive paper. No exams. Okay, so take a look at the syllabus after you've seen this. Take a look at Marmo. Take a look at Hans Rosling. Take a look at the first notes for the chapter 1 of the text. Scan through the text. We'll cover most all. There'll be a chapter 2 in the text we won't do, but we'll cover nearly all the chapters in the text. Take a look at. We're going to be in the demographic segment right away. Take a look at the readings in segment 2, the demographic segment, whichever one it is. It's the first segment on demographics. Take a look at those readings and begin getting a feel for them and deciding on which one that you might want to do. I will post this next week some prof's notes that summarize those readings. That will be a guidance for you to help you kind of navigate those readings and maybe pick one of interest to you. So that's it, and looking forward to working with you this semester. This is what I do. I don't just teach this class, but I am a population health specialist. I graduated from National Institute of Health funded Population Research Center up there at UT in Austin. Happened to be a sociologist because it was affiliated with sociology. I have a master's in public health. I am a population health analyst and do a lot of pro bono now, work out in the community with hospitals, mental health department, and on boards doing community health. So it is, this is my life. I like, this is what I do. So I enjoy this class, and I hope you will too. So this is Thursday. There's a weekend coming up. You all be safe out there, and we'll be back in touch in early part of next week.